Hello everyone. Welcome to this online lecture on virtual reality and rehabilitation, transforming patient recovery. I am Dr. Che-Wei Lin, an associate professor in the Department of Biomedical Engineering at National Cheng Kung University. As you can see from the slide, our focus today will be on how virtual reality technology is revolutionizing rehabilitation practices and significantly improving patient outcomes. This presentation stems from the research conducted at our Wearable Technology and Mobile Healthcare Laboratory, where we explore the intersection of cutting-edge technology and rehabilitation medicine. We will be examining the various ways VR is being utilized to enhance traditional therapeutic approaches, create engaging rehabilitation experiences, and ultimately accelerate patient recovery. Throughout this lecture, we will delve into specific examples, research findings, and future trends in this rapidly evolving field. I encourage you to actively engage with the material and consider the potential of VR to transform your own practices in rehabilitation medicine or medical engineering. Welcome, everyone. Today, we're embarking on a journey into the world of virtual reality and its transformative impact on patient rehabilitation. As this slide indicates, our exploration will encompass how VR is revolutionizing patient recovery across a wide spectrum of medical fields. From neurological conditions like stroke and traumatic brain injury to musculoskeletal disorders, pain management, and even psychological applications, VR is rapidly reshaping the landscape of healthcare. This presentation aims to provide an in-depth look at the technical components that drive VR applications, the clinical implementations that are changing patient care, and the future directions of this exciting field. We'll delve into evidence-based practices, examine various outcome measures used to assess the efficacy of VR interventions, and discuss the exciting potential for integrating emerging technologies like artificial intelligence and machine learning. By the end of this presentation, you'll have a comprehensive understanding of how VR is being utilized to create more engaging, effective, and personalized rehabilitation experiences for patients. Let's begin. Now that we have a foundational understanding of virtual reality, let's delve into a comprehensive overview of its applications in rehabilitation. This slide highlights the key aspects of VR in rehabilitation, starting with its definition and evolution. As you can see, VR rehabilitation has progressed significantly from basic computer simulations to the sophisticated, fully immersive, and interactive environments we have today. This evolution has been driven by technological advancements in areas like motion tracking, haptic feedback, and graphics rendering, allowing for increasingly realistic and engaging therapeutic experiences. Next, we explore the advantages that VR offers in rehabilitation settings. Compared to traditional methods, VR provides several key benefits. Increased patient engagement. The interactive and gamified nature of VR experiences motivates patients to actively participate in therapy, leading to improved adherence and outcomes. Precise measurement and personalized feedback. VR systems can accurately track patient movements and performance, providing real-time feedback and enabling therapists to tailor treatment plans to individual needs. Customizable difficulty and progressive challenges. VR environments can be adjusted to match a patient's abilities and gradually increase in difficulty as they progress, ensuring optimal challenge and motivation throughout the rehabilitation process. Finally, the slide touches upon market trends in VR rehabilitation. Notably, we're seeing growing adoption rates among healthcare providers as the evidence base for VR interventions expands and the technology becomes more cost-effective. This increased adoption is driving market expansion, leading to further innovation and development in VR rehabilitation solutions. Let's now delve into the technical underpinnings of VR rehabilitation, examining the key components that enable these immersive and therapeutic experiences. This slide outlines the three fundamental aspects: hardware, software, and interface design. Hardware elements. HMD specifications and requirements. The cornerstone of any VR system is the head-mounted display, HMD. For rehabilitation purposes, HMDs should prioritize high resolution, a wide field of view, and low latency to minimize motion sickness and maximize immersion. Additionally, comfort and adjustability are crucial for extended use during therapy sessions. Motion tracking systems. Accurate motion tracking is essential for capturing patient movements and translating them into the virtual environment. Various tracking technologies are available, including optical, inertial, and electromagnetic systems. Each has its own strengths and limitations in terms of accuracy, range, and cost-effectiveness. Selecting the appropriate tracking system depends on the specific rehabilitation application and the required level of precision. Software platforms. Commercial versus custom solutions. VR rehabilitation software can be broadly categorized into commercial off-the-shelf solutions and custom-developed platforms. Commercial solutions offer ready-to-use applications with pre-designed exercises and activities, while custom solutions allow for greater flexibility and tailoring to specific patient needs. Unity/Unreal Engine applications. Many VR rehabilitation applications are developed using popular game engines like Unity and Unreal Engine. These engines provide powerful tools for creating realistic 3D environments, interactive elements, and engaging gameplay mechanics. Data collection and analysis tools. VR rehabilitation software should incorporate robust data collection and analysis tools to track patient progress, measure outcomes, and provide valuable insights for therapists. These tools enable objective assessment of performance, identify areas for improvement, and personalize treatment plans. Interface design. Accessibility considerations. VR interfaces should be designed with accessibility in mind, ensuring that they are usable by individuals with diverse abilities and needs. This includes considerations for visual, auditory, and motor impairments. User experience optimization. A well-designed interface is crucial for a positive and engaging VR experience. This involves intuitive controls, clear feedback mechanisms, and an aesthetically pleasing environment. Safety features. Safety should be a paramount concern in VR rehabilitation. Interfaces should incorporate features to prevent falls, collisions, and overexertion. Clear instructions, safety warnings, and emergency stop mechanisms are essential for ensuring patient well-being. Understanding these technical components is essential for both clinicians and engineers involved in developing and implementing VR rehabilitation solutions. By carefully considering hardware specifications, software capabilities, and interface design, we can create VR experiences that are effective, engaging, and safe for patients. Let's now shift our focus to the application of VR in neurological rehabilitation, a field where this technology is showing immense promise for improving patient outcomes. As you can see on this slide, VR is being utilized across a range of neurological conditions, including stroke recovery, traumatic brain injury, TBI, rehabilitation, and spinal cord injury. Stroke recovery. VR offers a variety of interventions for stroke survivors, targeting different aspects of recovery. Upper limb rehabilitation. VR provides engaging and interactive exercises to improve upper extremity function, including reaching, grasping, and manipulation tasks. These exercises can be tailored to individual needs and progressively challenge patients as they regain strength and coordination. Gait training. VR allows patients to practice walking in a safe and controlled environment, with customizable terrains and obstacles to challenge balance and coordination. This can help improve gait patterns, increase walking speed, and reduce fall risk. Balance exercises. VR provides a dynamic platform for balance training, with interactive games and activities that challenge postural control and stability. This can help improve balance confidence and reduce the risk of falls in daily life. Cognitive recovery. VR can be used to address cognitive impairments after stroke, such as attention deficits, memory problems, and executive dysfunction. Engaging games and simulations can help stimulate cognitive processes and promote recovery. TBI applications. VR is also proving beneficial in the rehabilitation of individuals with traumatic brain injuries. Attention training. VR can provide engaging and challenging tasks to improve attention span, focus, and selective attention. This can help individuals with TBI regain the ability to concentrate and perform daily tasks effectively. Memory rehabilitation. VR can create interactive environments and scenarios that challenge memory recall, recognition, and spatial navigation. This can help improve memory function and reduce the impact of memory deficits on daily life. Executive function exercises. VR can provide simulations and games that require planning, problem solving, and decision making, helping to improve executive function skills that are often impaired after TBI. Spinal cord injury. VR is being explored as a tool for rehabilitation in spinal cord injury, offering new possibilities for recovery and adaptation. Movement pattern training. VR can provide opportunities for practicing movement patterns and regaining motor control in a virtual environment. This can help stimulate neuroplasticity and promote functional recovery. Compensation strategies. VR can help individuals with spinal cord injury learn and practice compensatory strategies for daily tasks and activities. This can improve independence and quality of life. Virtual environment adaptation. VR can simulate real-world environments and allow individuals with spinal cord injury to practice navigating and interacting with their surroundings. This can improve confidence and facilitate community reintegration. Neuroplasticity. Underlying the effectiveness of VR in neurological rehabilitation is the principle of neuroplasticity, the brain's ability to reorganize and adapt. VR interventions can stimulate neuroplasticity by providing engaging and challenging experiences that promote the formation of new neural connections. Research in this area focuses on understanding the mechanisms of action, developing evidence-based protocols, and measuring the impact of VR on neuroplasticity and functional outcomes. This slide highlights the diverse applications of VR in neurological rehabilitation and its potential to improve the lives of individuals affected by neurological conditions. By harnessing the power of VR, we can create engaging and effective rehabilitation experiences that promote recovery, enhance function, and improve quality of life. Let's explore another exciting area where VR is making significant strides: musculoskeletal rehabilitation. This slide provides an overview of how VR is being applied to various musculoskeletal conditions and injuries. Orthopedic applications. VR is proving to be a valuable tool in orthopedic rehabilitation, assisting with post-surgical rehabilitation. VR can provide a safe and controlled environment for patients recovering from orthopedic surgery to regain strength, range of motion, and functional mobility. Interactive exercises and games can make the rehabilitation process more engaging and motivating. Joint replacement therapy. VR can help individuals who have undergone joint replacement surgery to practice movements, improve joint stability, and regain confidence in their new joint. Tendon/ligament recovery. VR can provide targeted exercises and simulations to promote healing and functional restoration of injured tendons and ligaments. Sports injury recovery. VR offers unique advantages for athletes recovering from sports-related injuries. Sports-specific training. VR can create simulations of specific sports and activities, allowing athletes to practice movements and regain skills in a safe and controlled environment. This can help accelerate return to play and reduce the risk of re-injury. Performance analysis. VR systems can track and analyze movement patterns, providing valuable feedback to athletes and coaches on technique and performance. This can help optimize training programs and improve athletic performance. Return to play protocols. VR can be used to assess an athlete's readiness to return to their sport after injury. By simulating game-like scenarios and monitoring performance, VR can help determine if an athlete has regained the necessary skills and physical capacity. Balance training. VR provides a dynamic and engaging platform for balance training. Static/dynamic balance exercises. VR can create a variety of balance challenges, from static stances to dynamic movements, helping individuals improve their balance control and stability. Fall prevention programs. VR can be used to simulate real-life scenarios that may pose a risk of falling, allowing individuals to practice strategies for maintaining balance and preventing falls. Vestibular rehabilitation. VR can provide immersive environments for vestibular rehabilitation, helping individuals with dizziness and balance disorders to improve their vestibular function and reduce symptoms. Range of motion. VR can be used to improve joint mobility and flexibility. Joint mobility exercises. VR can guide patients through a range of motion exercises, providing visual and auditory feedback to ensure proper technique and progression. Strength training. VR can incorporate resistance exercises and functional movements to improve strength and endurance in a motivating and interactive way. Movement analysis. VR systems can track and analyze movement patterns, providing valuable information on range of motion, joint angles, and movement quality. This slide showcases the versatility of VR in musculoskeletal rehabilitation, highlighting its potential to improve outcomes for patients with a wide range of orthopedic conditions and sports injuries. By harnessing the immersive and interactive capabilities of VR, we can create engaging and effective rehabilitation experiences that promote recovery, restore function, and enhance quality of life. Let's now discuss another crucial area where VR is proving to be a game changer: pain management. This slide focuses on how VR technology is being applied to treat chronic pain and enhance traditional pain management techniques. Chronic pain treatment. VR offers a unique and effective approach to managing chronic pain by leveraging several key mechanisms. Gait control theory. VR experiences can activate the gait control mechanism, where non-painful sensory input, such as visual and auditory stimuli in a VR environment, can close the gate to pain signals, reducing the perception of pain. Distraction mechanisms. Immersive VR experiences can effectively distract patients from their pain by shifting their attention and focus to the virtual environment. This can be particularly beneficial for individuals with chronic pain who often experience heightened awareness of their pain sensations. Cognitive restructuring, VR can be used to challenge negative thought patterns and beliefs associated with chronic pain, helping patients reframe their perception of pain and develop coping strategies. VR-based interventions. Several VR-based interventions are being used for pain management. Exposure therapy, VR can create safe and controlled environments for patients to gradually confront and overcome fear and anxiety associated with pain, reducing pain-related avoidance behaviors and improving function. Relaxation techniques, VR can provide immersive experiences that promote relaxation, such as guided meditation, deep breathing exercises, and visualization techniques, helping to reduce stress and anxiety, which can exacerbate pain perception. Biofeedback integration, VR can be combined with biofeedback technology to provide patients with real-time feedback on their physiological responses, such as muscle tension, heart rate, and skin temperature. This can help them learn to self-regulate their physiological states and reduce pain. Mirror therapy in VR. VR is being used to enhance traditional mirror therapy, a technique that utilizes visual illusion to alleviate pain and improve motor function. Phantom limb pain, VR can create a virtual limb that mirrors the movements of the intact limb, providing visual feedback to the brain and reducing phantom limb pain. Complex regional pain syndrome, VR mirror therapy can help individuals with complex regional pain syndrome to regain motor control, reduce pain, and improve function in the affected limb. Neural reorganization, VR mirror therapy can promote neural reorganization in the brain, strengthening connections between the affected and intact limbs and facilitating recovery. Outcome measurements. To assess the effectiveness of VR interventions for pain management, various outcome measures are used. Pain scales, standardized pain scales, such as the Visual Analog Scale, VAS, and the Numerical Rating Scale, NRS, are used to measure pain intensity and track changes over time. Functional improvements, assessments of functional abilities, such as range of motion, strength, and activities of daily living, are used to evaluate the impact of VR interventions on physical function. Quality of life measures, patient-reported outcome measures, such as questionnaires and surveys, are used to assess the impact of VR interventions on quality of life, including physical, emotional, and social well-being. This slide highlights the potential of VR to transform pain management, offering new and innovative approaches to treat chronic pain, enhance traditional techniques, and improve patient outcomes. By harnessing the immersive and interactive capabilities of VR, we can provide patients with engaging and effective tools to manage their pain, improve function, and regain control of their lives. Now, let's explore how VR is being applied to enhance cognitive rehabilitation, an area of increasing importance in addressing cognitive impairments resulting from various neurological conditions. This slide outlines the key aspects of VR-based cognitive rehabilitation. Memory training. VR provides a dynamic and engaging platform for memory training, offering various exercises and tasks to improve different aspects of memory function. Working memory tasks, VR can present challenges that require holding and manipulating information in mind, such as remembering sequences, solving puzzles, or following multi-step instructions. These tasks help improve working memory capacity and efficiency. Episodic memory exercises, VR can create immersive scenarios and experiences that engage episodic memory, the memory of personal events and experiences. This can involve recalling details of a virtual story, navigating through a virtual environment, or remembering objects and their locations. Spatial memory training, VR can provide opportunities to practice spatial navigation and orientation within virtual environments. This can help improve spatial memory, which is essential for remembering routes, navigating familiar surroundings, and performing daily tasks that involve spatial awareness. Attention rehabilitation. VR offers engaging and interactive tools for attention rehabilitation, addressing different aspects of attention. Sustained attention, VR can present tasks that require sustained focus and concentration over time, such as tracking objects, identifying patterns, or responding to stimuli in a virtual environment. This helps improve the ability to maintain attention and resist distractions. Divided attention, VR can challenge individuals to divide their attention between multiple tasks or stimuli, simulating real-life situations where multitasking is required. This helps improve the ability to allocate attention effectively and manage multiple demands simultaneously. Selective attention, VR can present environments with competing stimuli, requiring individuals to selectively attend to relevant information while filtering out distractions. This helps improve the ability to focus on specific targets and ignore irrelevant information. Executive function. VR can be used to train executive function skills, which are higher-level cognitive abilities essential for planning, problem-solving, and decision-making. Planning exercises. VR can present scenarios that require planning and sequencing of actions, such as organizing a virtual workspace, solving multi-step puzzles, or navigating complex virtual environments. Problem-solving tasks. VR can create challenges that require problem-solving skills, such as finding solutions to virtual mazes, troubleshooting technical issues in a virtual setting, or making decisions based on limited information. Decision-making scenarios. VR can simulate real-life situations that require decision-making under pressure, such as responding to emergencies in a virtual environment or making choices that have consequences within the virtual world. Assessment tools. VR-based cognitive rehabilitation often incorporates assessment tools to track progress and measure outcomes. Standardized measures. VR can utilize standardized cognitive assessments, such as those measuring memory, attention, and executive function, to provide objective data on cognitive performance. Progress tracking. VR systems can track performance over time, allowing clinicians and patients to monitor progress, identify areas of improvement, and adjust treatment plans accordingly. Adaptive difficulty. VR can adjust the difficulty of tasks based on individual performance, ensuring that challenges are appropriately tailored to the individual's cognitive abilities and promoting ongoing progress. This slide highlights the potential of VR to transform cognitive rehabilitation, offering engaging and effective tools to address various cognitive impairments and improve overall cognitive function. By harnessing the immersive and interactive capabilities of VR, we can create personalized and motivating rehabilitation experiences that promote cognitive recovery, enhance daily functioning, and improve quality of life. In this section, we'll shift our attention to the fascinating realm of psychological applications for VR. As this slide illustrates, VR is proving to be a powerful tool in addressing a variety of mental health conditions. PTSD treatment. VR offers a unique and effective approach to treating post-traumatic stress disorder, PTSD. By creating immersive and controlled virtual environments, therapists can guide patients through exposure therapy protocols, helping them to re-experience traumatic events in a safe setting. VR allows for gradual and controlled exposure to trauma-related stimuli, enabling patients to process their traumatic memories and emotions without feeling overwhelmed. Develop coping skills. VR provides opportunities to practice coping strategies in realistic scenarios, such as relaxation techniques, grounding exercises, and cognitive restructuring. Facilitate emotional processing. VR can help patients identify and process their emotions related to the trauma, reducing avoidance behaviors and promoting healing. Anxiety disorders. VR is also being used to treat various anxiety disorders, including generalized anxiety disorder, social anxiety, and panic disorder. VR-based interventions can help patients gradually confront anxiety-provoking situations. VR allows for graded exposure to feared situations, such as public speaking, social interactions, or specific phobias, helping patients to gradually desensitize and overcome their anxieties. Develop social interaction skills. VR can provide a safe space to practice social skills and communication in realistic virtual environments, building confidence and reducing social anxiety. Manage panic attacks. VR can simulate panic-inducing situations, allowing patients to practice coping strategies and manage panic symptoms in a controlled environment. Phobia treatment. VR is a valuable tool for treating phobias, offering a safe and effective alternative to traditional exposure therapy. VR-based interventions can help patients systematically desensitize to feared objects or situations. VR allows for gradual and controlled exposure to phobic stimuli, helping patients to reduce their fear response and overcome avoidance behaviors. Develop a fear hierarchy. VR can be used to create a personalized fear hierarchy, allowing patients to gradually confront their fears in a structured and manageable way. Monitor progress and adjust treatment. VR systems can track patient progress and provide feedback on their responses, allowing therapists to adjust treatment plans and optimize outcomes. Depression management. VR is also being explored as a tool to manage depression, offering new approaches to address symptoms and improve well-being. Activity scheduling. VR can be used to create personalized activity schedules, encouraging patients to engage in enjoyable and meaningful activities that can boost mood and motivation. Social engagement. VR can provide opportunities for social interaction and connection, reducing feelings of isolation and loneliness that often accompany depression. Mood tracking. VR can incorporate mood tracking tools, allowing patients and therapists to monitor mood fluctuations and identify triggers, facilitating personalized interventions and support. To summarize, this slide demonstrates the versatility of VR in addressing a wide range of psychological conditions. By creating immersive and interactive experiences, VR provides novel and effective tools for therapists and patients to address mental health challenges, promote recovery, and improve overall well-being. Now, let's turn our attention to a particularly exciting application of VR, pediatric rehabilitation. As you can see from this slide, VR offers unique opportunities to engage young patients and enhance their rehabilitation journey. Child-specific applications. When applying VR in pediatric rehabilitation, it's crucial to consider the unique needs and characteristics of children. This includes age-appropriate content. VR experiences should be tailored to the child's age and developmental stage, ensuring that the content is engaging, relevant, and easy to understand. Developmental considerations. VR interventions should be designed to address the specific developmental needs of the child, such as motor skills, cognitive abilities, and social-emotional development. Safety protocols. Safety is paramount in pediatric VR applications. VR systems and environments should be carefully designed and monitored to ensure the child's physical and emotional safety. Motivational aspects. One of the key advantages of VR in pediatric rehabilitation is its ability to motivate and engage children in therapy. This is achieved through gamification elements. By incorporating game-like elements, such as challenges, rewards, and point systems, VR can make therapy more enjoyable and motivating for children. Reward systems. VR can provide immediate and tangible rewards for effort and progress, encouraging children to actively participate in therapy and strive for improvement. Progress visualization. VR can visually display a child's progress, allowing them to see their achievements and track their improvement over time. This can be a powerful motivator, boosting self-esteem and encouraging continued effort. Game-based therapy. VR enables the creation of game-based therapy, which combines the therapeutic benefits of rehabilitation with the engagement and motivation of gaming. This approach can integrate educational content. VR games can be designed to incorporate educational elements, such as teaching children about their bodies, health conditions, or therapy goals. Promote skill development. VR games can provide opportunities to practice and develop various skills, such as motor coordination, problem solving, and social interaction. Facilitate social interaction. VR can create virtual environments where children can interact with others, promoting social skills and reducing social isolation. Development considerations. When implementing VR in pediatric rehabilitation, it's important to consider the child's ongoing development and adapt interventions accordingly. Growth monitoring. VR systems can be used to monitor a child's growth and development, providing valuable data for therapists to adjust treatment plans and track progress over time. Adaptation protocols. VR interventions should be adaptable to the child's changing needs and abilities as they grow and develop. Family involvement. Engaging families in the VR rehabilitation process can enhance outcomes. VR can provide opportunities for parents and siblings to participate in therapy sessions and support the child's progress. In essence, this slide highlights the potential of VR to transform pediatric rehabilitation by creating engaging, motivating, and effective therapeutic experiences tailored to the unique needs of children. By embracing the power of VR, we can empower young patients on their road to recovery and help them achieve their full potential. Having explored the diverse applications of VR in rehabilitation, let's now shift our focus to the practical aspects of implementing this technology in clinical settings. This slide outlines the key considerations for successful clinical implementation of VR. Integration strategies. Integrating VR into existing clinical workflows requires careful planning and consideration. Key aspects include workflow integration. VR should be seamlessly integrated into existing rehabilitation workflows to ensure efficient and effective utilization. This involves identifying appropriate points in the care pathway where VR interventions can be introduced and ensuring smooth transitions between traditional therapies and VR sessions. Equipment management. Proper management of VR equipment is crucial for maintaining functionality and ensuring patient safety. This includes establishing protocols for equipment setup, maintenance, cleaning, and storage. Patient scheduling. Efficient scheduling of VR sessions is essential to maximize patient access and optimize resource utilization. This involves considering factors such as patient availability, therapist schedules, and equipment availability. Staff training. Adequate training is essential for staff members involved in implementing and utilizing VR technology. Training should focus on technical competency. Staff members should be proficient in operating VR equipment, troubleshooting technical issues, and ensuring patient safety during VR sessions. Safety protocols. Thorough training on safety protocols is crucial to minimize risks associated with VR use, such as motion sickness, falls, and overexertion. Staff members should be trained to identify potential safety hazards, implement preventive measures, and respond effectively to emergencies. Emergency procedures. Clear emergency procedures should be established and communicated to all staff members. This includes protocols for handling adverse events, such as motion sickness, seizures, or equipment malfunctions. Setup requirements. Setting up a VR rehabilitation space requires careful planning and consideration of various factors. Space planning. Adequate space is needed to accommodate VR equipment, ensure patient safety, and allow for comfortable movement during VR sessions. The space should be free of obstacles and hazards, and it should be designed to minimize distractions and promote immersion. Technical infrastructure. Reliable technical infrastructure is essential for supporting VR applications. This includes robust Wi-Fi connectivity, sufficient power outlets, and appropriate lighting to ensure optimal performance and patient safety. Safety considerations. The VR space should be designed with safety in mind. This includes installing safety mats or padding to prevent falls, securing cables and wires to avoid tripping hazards, and providing clear signage to guide patients and staff. In conclusion, this slide emphasizes the importance of careful planning and execution when implementing VR in clinical settings. By addressing key considerations such as integration strategies, staff training, and setup requirements, we can ensure the safe, effective, and efficient utilization of VR technology to enhance patient care and optimize rehabilitation outcomes. Now that we've explored the various applications and implementation considerations for VR in rehabilitation, let's turn our attention to evaluating its effectiveness. This slide focuses on the crucial aspect of outcome measures in VR rehabilitation. Measuring success. Evaluating the success of VR interventions requires a comprehensive approach that considers various factors. Patient satisfaction. Patient satisfaction is a key indicator of the acceptability and effectiveness of VR therapy. Studies have shown high engagement levels and compliance rates among patients undergoing VR-assisted rehabilitation. This suggests that patients find VR experiences to be motivating, enjoyable, and beneficial. Recovery improvement. A primary goal of VR rehabilitation is to accelerate recovery and improve functional outcomes. Research indicates that VR-assisted rehabilitation can lead to faster recovery rates compared to traditional methods. This is likely due to the increased engagement, personalized feedback, and progressive challenges that VR offers. Cost reduction. While the initial investment in VR technology can be significant, there is potential for cost reduction in the long run. VR can optimize resource utilization by allowing for remote rehabilitation, reducing therapist time, and potentially shortening the overall rehabilitation duration. Assessment methods. Various assessment methods are employed to evaluate the outcomes of VR rehabilitation. Standardized tests. Standardized assessments, such as those measuring range of motion, strength, balance, and cognitive function, provide objective data on patient progress and functional improvements. Custom metrics. VR systems can collect a wide range of data, including movement kinematics, reaction time, and task performance, allowing for the development of custom metrics tailored to specific rehabilitation goals. Progress tracking. VR platforms can track patient progress over time, providing valuable insights into individual responses to therapy and enabling adjustments to treatment plans as needed. Clinical effectiveness. Ultimately, the clinical effectiveness of VR rehabilitation is measured by its impact on recovery rates. VR interventions aim to accelerate recovery and reduce the time it takes for patients to regain function and return to their daily activities. Functional improvements. VR should lead to measurable improvements in physical and cognitive function, such as increased strength, improved balance, enhanced motor control, and better cognitive performance. Long-term outcomes. The true impact of VR rehabilitation lies in its ability to improve long-term patient outcomes, including quality of life, independence, and participation in social and community activities. In summary, this slide emphasizes the importance of comprehensive outcome measurement in VR rehabilitation. By utilizing a variety of assessment methods and focusing on key indicators like patient satisfaction, recovery improvement, and cost reduction, we can effectively evaluate the impact of VR interventions and ensure that they are delivering meaningful benefits to patients. As we conclude our exploration of VR in rehabilitation, let's look ahead to the exciting future directions and emerging trends that will shape this rapidly evolving field. Emerging technologies. The future of VR in rehabilitation is being driven by several key technological advancements. AI integration. Artificial intelligence is poised to play a crucial role in personalizing VR rehabilitation experiences. AI algorithms can analyze patient data, track progress, and adapt the difficulty and content of VR interventions in real time, optimizing outcomes and enhancing engagement. Haptic feedback. Haptic technology, which provides tactile feedback, is becoming increasingly sophisticated. This allows for more realistic and immersive VR experiences, enabling patients to feel virtual objects and environments, enhancing motor learning and sensory feedback during rehabilitation. Brain-computer interfaces. Brain-computer interfaces, BCIs, hold tremendous potential for VR rehabilitation. BCIs can translate brain activity into commands, allowing individuals with severe motor impairments to control virtual environments and interact with VR applications using their thoughts, opening up new possibilities for rehabilitation and restoration of function. Research priorities. Ongoing research is essential to further advance the field of VR rehabilitation. Key research priorities include clinical trials. Rigorous clinical trials are needed to evaluate the effectiveness of VR interventions for various conditions, compare VR to traditional methods, and establish evidence-based protocols for clinical practice. Validation studies. Validation studies are crucial to ensure that VR assessments and outcome measures are accurate, reliable, and sensitive to changes in patient performance. Protocol development. Developing standardized protocols for VR rehabilitation will ensure consistency in treatment delivery and facilitate comparisons across different studies and clinical settings. Clinical guidelines and standards. As VR becomes more widely adopted in rehabilitation, establishing clear guidelines and standards is essential. Clinical guidelines. Developing clinical guidelines will provide evidence-based recommendations for the use of VR in rehabilitation, helping clinicians make informed decisions about appropriate applications and treatment protocols. Best practices. Sharing best practices for VR implementation, including equipment management, patient safety, and staff training, will promote effective and responsible use of this technology. Safety standards. Establishing safety standards for VR hardware and software will ensure patient well-being and minimize potential risks associated with VR use. Telerehabilitation. The integration of VR with telerehabilitation offers exciting possibilities for remote healthcare delivery. Remote monitoring. VR can be used to remotely monitor patient progress, providing therapists with real-time data on performance and enabling adjustments to treatment plans as needed. Home-based systems. VR-based telerehabilitation can empower patients to engage in therapy from the comfort of their homes, increasing access to care, especially for those in remote or underserved areas. In closing, this slide highlights the exciting future of VR in rehabilitation. By embracing emerging technologies, prioritizing research, and establishing clear guidelines and standards, we can unlock the full potential of VR to transform rehabilitation practices, enhance patient outcomes, and shape a new era of healthcare that is more engaging, effective, and accessible. As we reach the end of this presentation, I want to express my sincere gratitude for your attention and engagement throughout this exploration of virtual reality and rehabilitation. I hope this session has provided you with valuable insights into the transformative potential of this technology. Key takeaways. Let's briefly recap the key takeaways from our discussion today. VR is revolutionizing rehabilitation across a wide range of medical fields, from neurological and musculoskeletal conditions to pain management and psychological applications. VR offers unique advantages over traditional methods, such as increased patient engagement, personalized feedback, and customizable difficulty. VR interventions are proving effective in accelerating recovery, improving functional outcomes, and enhancing quality of life for patients. The future of VR in rehabilitation is bright, with emerging technologies like AI, haptics, and BCIs poised to further enhance the therapeutic potential of VR. Looking ahead, I encourage you to continue exploring the vast possibilities of VR in your respective fields, whether you are a clinician, researcher, or engineer. Embrace innovation, stay informed about the latest advancements in VR technology and research, and consider how these innovations can be integrated into your own practices. Collaborate and share knowledge, foster collaboration between different disciplines to drive further progress in VR rehabilitation. Share your experiences, insights, and research findings to contribute to the growing body of knowledge in this field. Advocate for VR adoption, promote the benefits of VR in rehabilitation to colleagues, patients, and healthcare organizations. Advocate for the integration of VR into clinical practice and research initiatives. Final thoughts. I believe that VR has the potential to truly transform the landscape of rehabilitation, creating more engaging, effective, and personalized therapeutic experiences for patients. By embracing this technology and working together, we can unlock its full potential to improve patient outcomes and shape a brighter future for rehabilitation medicine. Thank you once again for your participation. I would also like to acknowledge the contributions of my dedicated research team, whose hard work and commitment have made this research possible.